Leadership in crisis, the role of the Surgeon General and Chief Medical Officer in responding to the COVID-19 pandemic. In this 10-minute presentation, I'll be exploring the critical role of the Surgeon General and the Chief Medical Officer during the COVID-19 pandemic and the critical role that these leadership positions played in shaping the public health response during the pandemic. In my capacity as the Surgeon General, I would serve as the nation's doctor during the pandemic, providing health information and guidance, while in my duties as the Chief Medical Officer, I'd be focusing on the internal health policies that are applicable in the hospital systems, with both roles being essential for effective communication and response strategies. In the leadership role as the Surgeon General or the Chief Medical Officer, effective management during a crisis requires a strategic and multi-tiered response to the COVID-19 pandemic, drawing not only from national guidelines but also practical adaptations implemented within the hospital systems, which would provide a robust framework that includes assessment, planning, and response phases for tackling both the immediate challenges posed by the pandemic, such as addressing resource limitations, and also long-term goals such as sustaining training for the healthcare providers during this prolonged public health crisis. That being said, our immediate goal would be to provide an immediate response to the increase in numbers and design a strategy that focuses on risk mitigation. So in the early phases of the pandemic, we would require swift action to limit exposure and protect both the patients but also our healthcare providers. So following the ACS guidelines, we prioritized postponing the elective surgeries to free up the resources for the COVID-19 cases that were presented to the hospital. By acting on this guideline, the hospitals are able to relocate staff and resources to other areas that have greater needs, such as people that are being affected presently by the virus. In the role as the Surgeon General, I would adopt a similar national policy, serving as the nation's doctor, emphasizing the postponement across the board of all non-essential procedures, particularly in areas that are highly impacted by the pandemic, to limit the patient volume and the potential viral transmission. So to be able to achieve that effectively, one of the things we have to focus on is our communication strategies. So the goal there would be having clear communication with the state and local agencies, and also to engage the public. So that way we have a uniform implementation of all these guidelines with a focus on reducing the public and hospital transmission rates. So building on that premise, we're going to be talking about public health messaging in terms of public health communication and community engagement. So clear communication is vital to the national COVID-19 response, with focusing on campaigns that promote mask wearing and vaccination, which are all measures that are important to influence public behavior and mitigate the spread of the virus. This being said, it requires a coordinated public message that promotes those safe behaviors and conveys the healthcare guidelines as they're being implemented in the healthcare systems, and be able to manage the public expectations by keeping them informed and keeping them engaged. As the Surgeon General, establishing that communication that combines not only providing the up-to-date information with the clear guidelines, but also building on that public trust that facilitates compliance with the health measures as they're being implemented. That would require collaborations with the local health departments and agencies that could also help to disseminate that accurate information, focusing on things like mask mandates, testing protocols, and social distances across the different communities. Additionally, there would be focus on outreach initiatives to provide PPE and vaccinations to the underserved communities, so that we address any disparities as we go through the COVID-19 pandemic and the impact that it has on all the different subpopulations, ensuring that the resources and the information and the testing is available to all the populations, and then through partnerships and community organizations that such as like religious groups and local leaders, that we could bridge information gaps and then build awareness about preventative measures and available resources. So that way we mitigate the COVID-19's effects on the marginalized community as well as the entire population. As the CMO or the Surgeon General, it requires a multi-tiered response to the pandemic that draws upon all these different things. So building on that, to be able to effectively mitigate the spread of the COVID-19 virus as a CMO or Surgeon General, sorry, it requires a collaboration with the different agencies. So strong collaboration with agencies like the CDC and the WHO enables a unified response to the pandemic, where this collaborative effort facilitates timely updates and resource sharing and enhances the overall effectiveness in managing the COVID-19 crisis. Another thing I focus on as the CMO, looking at hospital policies, is that the pandemic is highlighting the critical resource shortages, including the ICU beds, ventilators, and the PPE, as the cases rise. So part of our efforts is focusing on securing additional ICU beds and ventilators and other vital resources that are needed not only for the patients but also for our healthcare, our workforce, and highlighting that these resources need to be distributed fairly for the system to be prepared to manage the increasing demand of the situation. As the Surgeon General, looking at it from a community standpoint, we're also focusing on establishing a task force to track and distribute essential resources, like we said, the PPE, the ventilators, and the personnel across the healthcare system, not just one institution, and preventing isolated shortages in any one facility to allow for flexible response capabilities across the board. So one thing that as a CMO I need to focus on is the healthcare workforce management and providing those professionals with support. So during this time of crisis, because of the COVID-19 pandemic, there are immense demands on these professionals, which requires us to be strategic with our workforce, and in order to get the best outcomes, not only for the professionals but also for the patients. So on an institutional level, it requires restructuring of the residents and the attendings to have adequate coverage across not only the surgical unit but also the non-surgical units, as the residents are transitioned to focus their training on supporting the COVID-19 patient care. The hospital is also dividing residents further into daytime, nighttime, and backup teams to help mitigate workforce shortages and prevent physician burnout. Implementing a similar national strategies in my capacity as a Surgeon General would focus on high demand areas as needed based on the trends that we see from the increasing cases, to provide rotating backup in the form of a pool of health workers that covers any additional exposures or illnesses amongst the staff themselves. Another thing that needs to be focused on is mental health support for these healthcare workers, that this is like an emergent significant need that we're seeing as the providers face extended hours, increased patient loads, and high stress situations, and just the stress of going through this time as a human being. So implementing a national mental health support service and stress management resources, such as peer support groups and counseling, also offers essential relief and reduce burnout risk. So another way we can help this physician pool and the healthcare professionals on a whole is addressing misinformation. So looking at educational continuity and adaptation for healthcare training, we're combating misinformation, which has proven to be a significant challenge, through engaging in to correct the false narratives that are being spread in social media, and just in general print that's being circulated. In terms of our long-term goals and preparedness, we're looking at things like policy development. So, for example, in terms of like the vaccine rollout, which was a monumental task, which required strategic leadership on our part. As the Surgeon General and the CMO, we played key roles in ensuring the equitable distribution of the vaccines and also engaging in education efforts that engage the public and support trust in the vaccines. Additionally, the pandemic highlighted the need for a proactive and adaptable approach and policies that can be implemented in future health crises. Implementing these policy frameworks in the hospital streamlines the protocols that are needed for infection control and resource allocation, and ensures that the health systems are prepared for these high demand situations going forward. So, like I said, lessons learned. We learned that there is a need for adaptive leadership as in our roles as CMOs and Surgeon Generals. So one of the key things that we learned was the importance of preparedness, rapid response, and the ability to pivot strategies in real time based on emerging data. So, for example, we are focusing on implementing that telehealth infrastructure, enhancing our PPE protocols, and standardizing our ICU staffing. So, we're exemplifying the importance of preparedness in these goals. Just so in future, we are better prepared to handle such public health emergencies. Building on the principle of future preparedness, we also recognize the importance of needing to have a national task force to analyze data on public health crises in real time, such as the COVID-19 pandemic's impact, and evaluate the effectiveness of our responses to guide future policy decisions, and to provide regular updates on the preparedness plans and that are grounded in real world experiences that would be able to better enhance the healthcare that we provide and allow providers to be able to rapidly adapt and continue patient care to the best of their ability, even under the most challenging of circumstances. So, in conclusion, the leadership roles of the Chief Medical Officer and the Surgeon General is instrumental in navigating the complexities of the COVID-19 pandemic, and our actions in these roles set a precedent for future public health crises beyond the COVID-19 pandemic. These are my references. Thank you.